Hey, good morning, Dr. Bias. How was your morning workout?
It was outstanding. Thank you for asking.
Great.
Do we have any updates from patients on vancomycin therapy?
Now that you mentioned, we heard something about the bed 205, but I'm not sure.
Okay, I'll just check. Thank you.
That's great.
I'm so tired. Good morning, it's Dr. Valles here.
Hi, I am Dr. Bias. How can I help you?
My name is Brittany Hale.
And my name is Catherine Brisk.
And we are your IPP students for the infectious disease rotation.
Oh, I was expecting the both of you. Welcome to the infectious disease rotation.
Thank you.
So for today, you will just spend the day with me, following me around, so you can see the tasks I usually perform as an infectious disease pharmacist and as part of our Antimicrobial Stewardship Program here at San Cristobal Hospital. The first thing I do when I arrive to my shift is to verify the pop-up alarm system. These are orders for pharmacotherapy consults for those antimicrobials that require monitoring levels like aminoglycosides and vancomycin.
Dr. Valles, what is that yellow box?
What a perfect timing. This is the alarm for the pharmacotherapy consult order that I just explained. In this case, it's about a high trough level of vancomycin with an order for dose reduction. And it seems that our friend from the bed 205 needs our help. To give you a quick review, 3 days ago, the patient from the bed 205, who is a 69-year-old Afro-American male that presented to the emergency department unconscious due to a car accident. He was admitted to the ICU upon arrival and put in a ventilator. The patient acquired pneumonia after 48 hours. Yesterday, the physician ordered Solsin 4.5 grams IV every 6 hours and vancomycin 1 gram IV every 8 hours, with an indication for ventilator-acquired pneumonia. As part of our Antimicrobial Stewardship Program here at the hospital, I also verify all the orders of antibiotics and assure that the treatment is adequate for the diagnosis stated in the order. So, based on this patient profile, what is missing in this treatment regimen?
Well, according to the IDSA guidelines, double anti-pseudomonal agent and anti-MRSA therapy is needed for the management of ventilator-acquired pneumonia. In this case, the physician order is missing an anti-pseudomonal agent.
Perfect! And which antimicrobial do you think that I recommend to the physician?
Another anti-pseudomonal agent, I think, is levofloxacin, 750 milligrams every 24 hours, I think.
That is exactly what I recommended to the physician yesterday. Therefore, he agreed and placed a new order with the new regimen. Great thought process. Brittany, can you mention what are the benefits of these stewardship practices?
This stewardship practice will increase the coverage and adequate initial treatment for the patients. And this will assure that the patient is not undertreated and improve overall patient's outcomes.
That is excellent.
Also, once susceptibility results are available, the escalation is recommended to avoid resistance.
I have to say, girls, that is fantastic, and I would love to work with you in the future. Now, let's see what is happening with our patient in the bed 205, so let's go to the floor and see the nurses. Good morning, Erica.
Hi.
I'm here with my new APP students, Brittany and Catherine, and they're from Nova State University. We're here because we received an alarm for a pharmacotherapy consult for vancomycin from bed 205. Do you know which nurse had this patient in charge?
Yeah, I have that room assigned. What's the problem?
I just want to double check the time where the vancomycin levels were drawn.
Well, the levels were drawn 30 minutes after giving the 4th dose of vancomycin.
Oh, as I suspected. Thank you for the information.
Yeah, sure.
Catherine, why do you think vancomycin levels were high?
Well, the trough level was taken right after the 4th dose was given, so high levels are expected.
Brittany, when we should draw the levels of vancomycin?
30 minutes before giving the 4th infusion.
That is correct. Outstanding, students. Now I will call the physician to explain the situation. Let's call him. I have his phone right here.
Good morning, this is Dr. Rodriguez.
Good morning, Dr. Rodriguez. This is Dr. Baez, the infectious disease pharmacist. I am calling you about patient in room 205. You placed an order for vancomycin dose reduction, but I really recommend to keep the current regimen and retake the levels 30 minutes before giving the next dose to obtain an accurate level.
No, why I will do this? Like, the trough level was 25 micrograms per milliliter.
Yes, I understand, but it was not a true trough because the dose was taken right after the fourth dose was given, so high levels are expected. The level it is supposed to be taken 30 minutes before the next dose is given in order to obtain the most accurate level. This represents the time that the lowest concentration of the drug is in the body. So this will occur right before giving the next dose, not after. Also, the other labs of the patients are normal and there are no signs and symptoms of toxicity.
Well, okay, I will place the new order. Thank you for letting me know.
Thank you for your time. Okay, students, we have just experienced a live example of prospective audit and feedback. So, let us provide an in-service to educate nurse, department, and physicians about pharmacokinetics and pharmacodynamic parameters of vancomycin for next week.
Good morning, my name is